Welcome to the New World Order Showcase Podcast. Your host, Jill Hart, the Coach's Alchemist. Couldn't be more excited to have you join us today. On this podcast, we celebrate the champions of change, the up-and-coming life, health and transformational coaches who are fearlessly stepping forward to make a difference in the world. Get ready for inspiring stories, practical tips, and powerful moments that will motivate you to make a positive change in your life and those around you. We're happy to have you join us on this incredible journey as we dive into the world of life, health, and transformational coaches who are lighting up the path towards a better tomorrow.
Hi, and welcome to the New World Order Showcase podcast. Today we are talking with Marie Hoag. Marie does all kinds of things, but mainly she has worked in the hormone field in medicine for like the last 2 decades. I'm just going to let her explain what she does because it's intense, and I know we all need this information, but I'm going to just pass it over to you, Marie. Thank you so much for joining me, first off. And I'm really looking forward to hearing what you have to share about balancing our hormones, especially as we're getting older. So welcome to the show. Tell us what you do and how you do it.
Well, thanks so much for having me on the show. It's really a nice meeting with you today. Yeah, hormone balance is really a hot topic right now, as you know, with perimenopausal and menopausal women. And I'm a clinical hormone coach, but that's just a term I made up in the clinic because that's what I was doing. And I work with a group of physicians right now across the country because I do telehealth now. And I work with them and their patients. They're mostly their female patients, but I have a lot of male patients, usually the significant others of my female patients. I help them use the hormone replacement therapy that the physicians prescribe to use that to get to hormonal balance. And hormonal balance is like, it's really a transformational process to a destination. And when we found out that you can't just give a woman hormones and think it's going to magically change things, we were hoping that would be the case, but it's not like that at all. Women need to understand what the hormones are, what we're trying to achieve, what that process is like, somebody to hold their hand through that process. Because when you restore hormones, it takes a while. You can't just slap a patch on a woman and call it good, though a lot of doctors do. But I get, as I mentioned earlier when we were speaking, that the term hormonal balance gets thrown around a lot by people who are selling products to menopausal suffering women to give them relief, because everybody knows that menopausal women are suffering from hormonal balance, which means they're pretty miserable mentally and physically. So there are people trying to sell products to manage those symptoms. And well, the type of hormone replacement therapies I've been working with over the years in the clinic are of therapeutic dosing. And that means that you have to give the patient a little bit at a time to restore those levels that mimicked her when she was the most hormonally healthy. So this takes a bit. Go ahead.
Does it go up and down? Because I know a woman's hormones fluctuate during the month when you're having a cycle. Does the hormone replacement therapy now include kind of a mimicking of that cycle, or is it kind of a static thing? How does that work?
That's a really good question. When I teach physicians how to prescribe hormone replacement therapy, I talk to them about hormone replacement therapy as being tools in their arsenal. there's an end goal that we're trying to achieve, and that's optimal levels in the blood. And there are different types of HRT systems that can get that job done, some sooner than later, and some don't achieve those levels at all. So I've broken down these HRT systems into generations so I can describe what each generation does. Third and fourth generation HRT systems are what we call rhythmic protocols. Rhythmic protocols are the gold standard of hormone replacement therapy because the goal of the HRT system is to replicate the natural physiology of each hormone so that when the patient takes that hormone, they're mimicking the natural physiology that hormone is produced. So yeah, there's an ebb and flow of estrogen and progesterone, but there's a big misconception on that these ebbs and flows of the hormones are what causes the mood instability and the irritability and the mood and the other issues that women face. But that's not really the case. It's when these levels flatten out. It's when we're not getting those physiological peaks and valleys. So it's not the highs and lows that make women crazy. It's the flattening of these. The estrogen and progesterone work together in this rhythmic cycle over a steady period of time if they're optimal. So the goal is to restore hormones that tell your brain you're really a young reproductive woman, and you do that by restoring hormones that mimic a natural menstrual cycle for a woman. This does a lot of things to a woman's brain and body. One, it wakes her brain and body up again, and to have her say, hey, I'm really, younger than what my hormones tell me. Because the low static dose hormones, low hormones tell the brain a woman is old. Optimal levels of hormones tell the brain of the woman that she's in her reproductive prime. And so it really is those levels that indicate these things that we've come to find. So yeah, it's best to mimic the natural hormone cycle. I've been doing that for years. I started off on low static dose when I was first learning about this almost 20 years ago. And then I learned about rhythmic protocols and tried that myself. And that protocol, which was, almost one of the first rhythmic protocols, which is the Wiley protocol, a third generation HRT system with a lot of clinical challenges to it, but it's still a decent protocol. It really changed everything in hormone medicine. It allowed women to choose if they wanted to maintain a healthy menstrual cycle or not, to establish one, reestablish one, and to maintain one. And that was a life-changing experience for me, the rhythmic protocol.
It's really interesting. How does birth control play into all of this? I've kind of wondered if people that use birth control in their younger years, in the reproductive years, don't have a different post-menopause experience. Do you have any insight into that?
Yeah, unfortunately, young women, it takes about 12 to 18 months for young ladies to go through the pubescent transition, for the hormones to kick in enough to regulate that menstrual cycle month after month. During this 12 to 18 month process, these young women are going nuts. They're having mood swings, anger outbursts, pelvic inflammation, cramps. I mean, you name it, from mood issues to mental illness diagnoses to period cramps, just very painful. And some of the moods and behaviors can be so outrageous for these young women that they're very difficult to live with. And some are very concerning. I've had parents call me going, I don't think you understand what my daughter's having these meltdowns. I'm like, no, I know what you're talking about. I've seen it because I had a daughter too. And I went through that myself when I was hormonally deficient, now that I know what that is. And so what happens is the parents take these young women to the doctor saying, do something with her. She's mentally ill. She has anxiety, she's depression, she can't sleep, she's crazy. We don't know what to do with her. And the doctor says, okay, well, she probably has depression. And then they put her on birth control pills and antidepressants. So they start their psychotropic drug cocktail here at this point. So they're put on the hormonal birth control. The hormonal birth control tricks the brain into thinking a woman is producing enough estrogen, so she stops producing her own estrogen. And that birth control, that hormonal contraception, manages the FSH. So the signaling to the ovaries is that a woman is producing enough estrogen, when in reality she isn't. So these young women are put in chemical menopause at a young age. So the ovaries are shut down from the get-go. These young women are typically on this hormonal contraception for many, many years, some into the mid-30s. Oh, I'm ready to have kids now. I've done this, I've done that. They think that they can put off having these families, but their bodies are you may be able to freeze your eggs, but your body is still aging. And there's more to having children than eggs. And so when these young women go to get off their birth control, their ovaries have never kicked in. They've never worked. And so these women have a hard time getting pregnant. And then when they do finally get pregnant in their mid-30s and have their baby, their ovaries don't kick in after their children. And these women typically have a more severe postpartum depression. And they go through perimenopause quickly, and they do head into menopause quite quickly. So yeah, it's really how it's set up now, unfortunately, which is why we see a lot of mood issues in young women. And in fact, most women, because of this, and that was my life, exactly, and a lot of women. And really because of this, women have never have lived a day of their life with plenty of estrogen in their system. They don't know what it's like. They've never even had a taste, because the ovaries have always been shut down or suppressed. And then they're put on, and then finally, when they are complaining to their doctors in their perimenopausal years saying, please, I can't live anymore. I feel like I want to die every day, and I don't like people, and I don't want to live, and my anxiety is through the roof. And then they get a different psychotropic drug cocktail, and then they go into menopause. And this was not a life that was happy for me. It was not a good life. And there aren't too many women that say, oh, well, this is good. This really worked out well for me. It wasn't until I got a taste of estrogen that I realized the impact that estrogen really has on the brain, mind, and body of a woman. And to keep a woman deprived of estrogen her entire life, I believe, is barbaric. It's especially when you go through the before and after. It's interesting, because the transitional process getting to that place of full hormone restoration, it really opens up the mind and body of a woman, that she's able to get a better perspective of her life. And the more estrogen she gets, the more her body heals, the more her brain heals, and the more she's able to put things in perspective. And real emotional and mental health healing takes place during this process. This is why right now I'm seeking out the hormone coaches that I'm looking to train. Are the best ones are mental health practitioners, because of this transformational process. So there's a group I'm working with right now, as I'm explaining to them in their training, as you restore hormones, a lot of what you're dealing with right now in your practice will not be something you'll be dealing with. The depression won't be there. The anxiety won't be there. The insomnia, the low libido, the low energy, the low motivation, the lack of cognition. When you restore hormones in a woman, it changes who she is to the person she really is on the inside, if you give her the right amount. And then so when you take away all the side effects of hormone deficiency, such as depression, anxiety, and all those things I mentioned, all the things that women suffer with in menopause, if those are gone.
I think they kind of suffer from them often even before menopause, if what you're saying about birth control is accurate, and I can't imagine it's not.
Yeah, and that was for me. I mean, I was diagnosed at a very young age. I was 17 as severely clinically depressed. My doctor told me that I would be depressed my entire life. It was severe. He had me on about 6 different psychotropic drugs. He told me this would be my life at 17. And I asked him, how do you know that this is my life? How do you know I'm always going to be like this? He goes, well, because I treat your grandmother and your mother for the same thing, and y'all are on the same medications. So I don't see this getting any better for anybody. And I was 17. And at that time, I thought, well, at least there's something explaining why I feel crazy. There's a name. It's depression. And this was at a time when Prozac was just coming out and they were putting everybody on it. Oh, well, you have a chemical imbalance. And, they talked to me about neurons and synapses and how, there's a problem with the chemical imbalance. And I believed it, and I'm like, oh, well, that explains it. Oh, good. I'm not just this, I'm not just this horrible person that everybody's complaining about being around. And I really bought that. And I spent the majority of my life on and off of different types of psychotropic drugs, in and out of mental hospitals, suicidal attempts, 2 and 3 suicidal attempts over my lifetime. This is how bad it was. And I was put on birth control pills, and I spent my life on the psychotropic drug cocktail merry-go-round, because I was told this was who I was. This was the treatment. And so it was life-changing when I got on a rhythmic adequate dose protocol, that when I finally got enough hormones for the first time, it was just like shocking to me. And I talk about it like it's very life-changing, and I try to be careful with how I talk about it because it almost sounds too good to be true. But I wouldn't be alive today if I didn't go through that transformational process. So I was fortunate enough to meet a group of physicians who thought outside of the box. When patients kept saying, well, my hormones are low. Well, that's all they tell us to give you. I can't give you any more. Well, what do I do now? I'm back to wanting to kill my husband. I'm on hormones, but now I'm back to where I was. Now I'm on hormones. I'm paying more on hormones to be the same person I was on these low dose hormones. So this is what women get when they go to their doctor. They get the low dose hormones. They don't get the restoration. They get the lowest dose possible to treat the symptoms of hormone deficiencies. And so what I advocate for and what I work with are therapeutic dose protocols that are prescribed in a way that restores and maintains a healthy menstrual cycle for women for as long as she chooses. Like I've been out of menopause, for 15 years. Well, I've been in and out of it 3 times, but that's just kind of been my journey. But I can't imagine ever going back into menopause. I just, it's not menopause. And I know this is really controversial, but I talk about menopause prevention, as you probably read. But when a woman can control the quality of her menstrual cycle, she's really controlling the quality of her brain, and she's controlling the quality of her mind, and she's controlling the quality of her body and how she's aging and how she's declining. And I'm not saying that a woman can reverse aging, though there is some sort of reversal to it to a degree that you can't deny. But women, they just don't age the same. And it's mostly because of the hormone signaling, because the brain is under the impression that a woman is in her reproductive prime, not in her place of trying to prepare to die, which is just different. So, it is a transformational process, and it is a journey. It takes about 12 to 18 months to restore the hormones in a way that allows the body to adapt to them and to utilize them in a timely fashion so you don't freak the body out. There is a way to do it. So there is a technique and a process for restoring hormones in women.
It's really interesting. I've already gone through menopause. I've been out of menopause for over a decade. Or out of cycling. And I've reached a point where I wouldn't want to go back. It's like
a lot. And, so it's really interesting when I talk to postmenopausal women. First, you really have to identify what is menopause. A lot of people think that menopause is a state of being. It is a physiological state, but it's brought on by the ovaries shutting down. It doesn't come on until the ovaries shut down and the body stops producing testosterone, estrogen, and progesterone. If a woman can start therapeutic dose hormone replacement therapy before the period stops altogether, then the tissues in the body will have the least amount of damage due to hormone deficiency. So there's 4 stages of postmenopause. If you can catch a woman in the first 2 stages of postmenopause, you can restore a healthy menstrual cycle for her for pretty much for the rest of her life if she wants to. Women in stages 3 and 4 postmenopause, usually there's so much tissue damage that has taken place with a body that you can't really resurrect the heart, the tissues, the lungs, and the body, the physical body, like you can in stages 1 and 2. That doesn't mean that women don't benefit from a good therapeutic dose, but you just wouldn't take the same type of dosing as a woman, but just up to that point of, and then a lot of stage 3 and 4 postmenopausal women say, "Oh, I don't really care about that. I don't really want to do. I'm good." There is an adaptation that takes place in women when they lose their main sex hormones, where their brain and body adapt to. I'm good with this. I'm good with this. I don't need. They just adapted to it, and that's okay. And these women, they think, "Oh, well, let me see what it's like to have some hormones," and then they get some. Like, okay, this is good. This is good. So it's just, I like to catch women when the best time to start hormone replacement therapy for any woman is the moment she decides that she's not going to have any more children, when the childbearing days are over. Once that decision's been made, now it's time. You don't really want to go down that perimenopausal decline into the abyss of nothingness. You really do want to catch it at that time and keep your body healthy longer. So you're not making that dip. You're actually holding off that health. It kind of the decline's a little slower than if you were to just take a nosedive with a hormone deficiency.
If you're cycling, doesn't that mean you're still dropping eggs each month?
No, actually, once you're out of eggs, you're out of eggs. You can still cycle. In fact, you can even still cycle without a uterus. A period and cycling are 2 different things. Like I had a hysterectomy a few years ago, so I don't have a period, but I still cycle. Because when a woman's body is menstruating, if you're having a cycle, this is the sign of optimal health in women, is this incident-free, no PMS. That's one of the ways that we know if hormones are balanced. If our patients have PMS, hormones aren't balanced yet. We monitor 50 clinical indicators. So PMS, headaches, mood swings. If a woman still has those things, then her hormones aren't balanced yet. And we fine tune the hormones until the majority, about 85 to 90% of those things are gone, either completely eliminated or significantly reduced. So yeah, if a woman is on hormone therapy now and it doesn't feel like her hormones are balanced, I highly recommend looking into getting on a therapeutic dose HRT system that changes how the brain and body function, because it really transforms a woman. She gets her brain back, her cognitive decline starts to reverse, and now she gets her brain back. The brain fog goes away. That's the first thing that happens with women, is that brain fog clears within about 40 to 50 minutes on a therapeutic dose. That's not very long.
No, it's really interesting. I had no idea the technology and it really is kind of technology that has allowed the hormone replacement to advance to a point where it can mimic a cycle and it can help you retain the
And it's been
youthful.
because of these pioneer physicians and scientists who said, I'm going to, this, so one of the questions that came up in our meeting was just like, these patients are asking for more estrogen, but we're maxed out on what they say, but nobody's giving us straight answers on what is that dose. And so we were in the meeting saying, well, let's just give women enough estrogen until they stop begging for it. And let's see what those numbers are. And that's what happened. It's like, well, give me more. And then when they stop asking, we find, oh, well, women, when they're in this range, they feel their best. They come into the office saying, oh my gosh, but this is so good. Thank you so much. And then, so this is how we know, but most doctors don't know that there is this place on the other side of what the package insert says on the patch. And so I do recommend physicians to get trained in therapeutic dose HRT systems. It's actually would make the world a better place if we had more physicians who knew how to prescribe hormones that give women their brains and bodies back.
Yeah, it's kind of like we're going to give you candy, but we're only going to give you like this much.
So that's just what's that about? Because that's what we first learned in our education. And that was my first HRT system. And that's what we were using in the hormone clinic in the beginning, 20 years ago. But then we were like, the doctors in the clinic, it's like, well, is everybody else having the same problems? It's like the hormones aren't working anymore. Why is that? Well, how long was your patient on? Oh, 6 months, me too. So why are these, all the hormones are stopped, they're not working in 3 to 6 months. Why? So we'd go back to the conference and say, okay, is anybody else having this issue? What's the solution? But we don't get answers. And so what are we supposed to do? Now it's either increase the hormones or start writing prescriptions for psychotropic drugs that now are back. Because what happens is these low dose therapies, women just really suck up that dose. Their brains and bodies require more than the patch and what these low dose treatments offer. So the receptors will suck it up. It's like taking a pain pill after surgery. Guess what? In 2 days, you're going to need 2. In 3 days, you're going to need 3. And it's just like that. And when the doses are low. But once you restore hormones in that therapeutic dose range, then now the brain and body have enough hormones to get to work and do what it needs to do. So the brain isn't in this panic, anxiety-ridden mode of survival.
Mm-hmm.
But once you get a woman out of that state of survival, she's a different woman. She's now who she is. She's strong. She has confidence. She has her wits about her. She can make decisions confidently. She has better coping skills. She can handle the things that come her way. And this is like night and day. This is the best part of hormone therapy, is the way it gives women their life back, or their life at all. Like me being put on birth control pills and antidepressants. I never knew what life was like with estrogen. Or you give a woman like me estrogen who's never had it, it's like, oh my gosh, okay, this is me. This is who I am. I'm not this mental illness. I'm not this depression. I'm not this anxiety. Who am I now? And that was one of the questions I asked my doctor. It's like, I don't know. I spent my entire life being this person with mental illness, and that's gone now. So I don't even know who I am. And he said, well, isn't that going to be nice to find out? And that was the second half of the journey that I found quite interesting on the other side of that hormonal balance. Now, who are we and who do we want to be? And that's actually a pretty beautiful place to be.
Can I ask you a personal question? And this is just for my own, I'm putting this information together for myself. But do you have children?
I have 2.
You have 2. Okay.
Mid-30s.
I'm sorry?
I had them in my mid-30s.
I've had 5. I had some when I was in my 20s, and I had some in my late 30s, early 40s. I'm wondering if that has something to do with how hormones work too. Women who never have children versus women who do have children and have more children versus less children, how all of that plays into we have these cycles, but when you're pregnant, it interrupts it and it shifts to a different set of hormones that are running through your body. And then when you're done having children, then they behave differently. And this, I don't know where I'm going with this, but you've just like raised a bunch of questions for me about, how does this aspect fit into what's going on? Has there been any research done on it?
You bet there has. There's one conference I went to 4 times, the same conference, because the lecturers spoke about the rhythm of the universe and the cycles of the universe, and when we're supposed to reproduce, and how things shut down when that time is over, and how our bodies work in this rhythm. And it's all about the rhythm. And I just found that extremely fascinating. And this is why we want to recreate that rhythm and bring that rhythm back, because it is a sign of health. And as long as your brain and body are in this place of health with this menstrual rhythm, which helps the circadian rhythm, which helps with moods. I mean, everything in the female body from head to toe down to the core of every cell is dependent upon estrogen. And when we continue to ignore estrogen or keep it too low in women, we can't really be the type of women that we're designed to be. And what's interesting about the whole pregnancy thing, and part of my research was looking into this because I found it fascinating, especially our mother's ovarian dysfunction that was handed down to us, who her mother's ovarian dysfunction was handed down. And I get really excited about the type of research that leads me into, but right now my most current research is the transgenerational inheritance of ovarian dysfunction. What that means is we are about 4 or 5 generations deep with ovarian dysfunction. We have been handed down broken ovaries generation after generation. And so we don't produce. This is why young women are not able to go through their pubescent transition the way that they should. Their ovaries are broken from the get-go. There's a big misconception that women give birth to daughters with healthy ovaries. Okay, here you have your healthy parts, and then you can ruin them and break them down as you get older. But that's not what happens. Women with broken ovaries do not give birth to children with healthy testes or healthy ovaries. It's one of the reasons why we see such a high rate of gender neutrality in this generation. We're not producing the hormones that we need to make it through this transition. So, and when to have children. It's like if you notice that when women have children after their after their first child, the body will bounce back pretty well. Second child, not so much. Why? 2 boobs, 2 kids. We're not unlike any other animal. Once we have the amount of kids that we can feed at one time, even though we don't have them at one time, then our hormones say, okay, it's over, and we start checking out, and then we make way for the next generation, for the young women whose bodies can handle that sort of thing. Though we do have children well beyond that, because we can, but we're instinctual human beings, instinctual animals. And so our bodies function in certain ways. And so if you're continuing to have children beyond the time that we do, like beyond the second child, then we're continuing to put our body back into this place. And yeah, the longer you can have children, the longer you can hold off on that. For some women, it's better. And then when women that don't have children, it really does wreak havoc that I won't get into on the body. And the body isn't protected from pregnancy, helps protect women against breast cancer.
Yeah.
So there's a lot of data on that. But yeah, there's some lectures I went through so many times, because every time I go, I learn something new, even though they're talking about the same thing, because it's just so fascinating. And then when
you can't possibly hang on to every little piece that they're giving you.
I know, and that's why. And then when you take it to the clinic and I see what's going, okay, this is interesting. This is interesting. So I'm like, what did you do with this? What did you do with this? So now it's just this discovery. And this is how it's been over the past 20 years. And because women are demanding it, women and men, it's like, like we didn't treat perimenopausal women years ago. Come back to us when your period stopped. Well, they weren't going to have that. So we had another meeting. Okay, all these women in their 30s and 40s, do we really want to wait until their periods stop? Listen to them. They're horrible. So you can either write them prescriptions for psychotropic drugs, or you can restore their hormones, regulate their periods again, and keep them from going into this decline. And then you won't have to write prescriptions for psychotropic drugs. I mean, it's like this. So then the doctor's like, well, let's just see if I can get her to feel good, if I can. And so that's how we found that place of what is that optimal place of hormonal balance. And then like I said, what I do now is teach doctors the technique and the process. You start here, and then this is a technique of a titration adaptation process of hormone therapy. And so as a coach, I work with women to say, okay, this is how you prepare your body for hormone therapy. This is what you're going to expect when your dose is increased. This is when that's going to go away, because it's like clockwork. It's not like it's that different from woman to woman. Like people, oh, this is very individual for me. Well, to a degree. Yes and no.
I know you offer a 27 reasons your hormone therapy isn't working gift for women. You
Yeah,
want to talk about that for a second?
I over the years, you realize the things that people do that get in the way of their hormone therapy. Because we had to figure out, why is this hormone therapy not working? Why is this patient, when they were feeling good when they came, and what happened? What are they doing? What are all the influencers that would make the hormones work or not work? And so I wrote that book when we saw, okay, what are all the influencers? These are all the things I have to talk to patients about. If you smoke, you're going to have a problem. If you eat hot and spicy pork rinds and drink cherry Slurpees, you don't come to me and complain about how crappy you feel on your hormones. It doesn't work. And so that book is really, if you're on hormone therapy, and because I was thinking 27 reasons, that's a lot of things that would impact if hormone therapy is going to work or not. But I tell you, there's no more extensive list from somebody who's worked in a clinic who have seen these things make an impact. So yeah, if your listeners are on hormone therapy and they don't really feel like their hormones are working, yeah, they can go to my website and download the free ebook, 27 Reasons Your HRT is Not Working. And I believe that I think there's a link on there for a free consultation too, if there's any questions. Because it's just listening to what I've been saying here, these few minutes, there's a lot of questions I think your listeners will have. And I'm happy to help them out with that.
I may have to come and talk to you because I'm sure that I'm going to have like 47 more questions.
Well, there's just a lot to know, because when's the last time you heard somebody say, oh, by the way, you can restore your hormones that mimic a woman in her reproductive prime until you die?
Yeah, no, I haven't heard that ever.
The benefits of that. People don't like to hear me talk about menopause prevention, but really delaying menopause, preventing menopause, and reversing menopause, in my opinion, is the future of menopause medicine. Because I think women they're learning what estrogen really does, and that it really doesn't do these bad things. And you have to ask yourself, why is there such a negative image of estrogen? Well, there's a reason for that. And those are things that I go over. So in the menopause prevention book too, I also wrote a book called Menopause Prevention that you can get on Amazon. But yeah, it's a lot more questions come up when you realize, oh, I have an option. I have a choice. I don't have to experience menopause. Yeah. So yeah, I wouldn't have believed it if somebody told me. And people have warned me, don't use that term menopause prevention. You're going to scare everybody away. I'm like, well, then what is it? No. So if you look at menopause as not, like I mentioned, it's not a state. Well, it is a state that happens to women who don't have enough estrogen. You give a woman enough estrogen and progesterone, guess what? She has a menstrual cycle again. Whether it's intentional or not, you give her enough the right way, she'll get a period again. Now what? Is she in menopause? Because menopause really is the cessation of the menstrual cycle, no more, no less. Everybody else tries to put, oh, you're in a state, you're in menopause. You have these symptoms of menopause. Menopause doesn't have symptoms. Menopause is a symptom. It's a symptom, just like depression, anxiety. It is, because you don't have it if you restore the things that are causing it, which is, I don't have a period. I haven't had it for a year. That's menopause. You give a woman estrogen and progesterone and you cycle it and you restore it in a way that mimics a woman in a reproductive prime, and she has this incident-free menstrual cycle. When women restore their hormones this way, you'd think, who wants a period? Well, and people think periods come with PMS. No, PMS is estrogen deficiency. Women with plenty of estrogen don't have PMS. Fully restored women don't really have PMS. They may have a punky, maybe not feel good, maybe for a couple hours the day before their period. But most of the complaints I get from women and period, when they get their periods back, is, I wasn't prepared. I didn't know I was going to start today. I always know when I'm going to start weeks in advance. I'm wearing white pants, and they complain. And it's like, really? I'm like, you knew you stopped taking your progesterone, the way your hormones are set up. You knew you were going to start your period on this day. I know, but I was just living my life. It's like, it's so non-incidental. The biggest pain is, oh, do I have enough tampons? Or I started when I didn't realize it, because they don't have all of that PMS that everybody, oh, well, that's normal. Well, it's normal in women who are estrogen deficient. Yeah. But yeah, it was like that with me. And my first experience is like, oh, I started my period today. Well, that's crazy. You know, I didn't know. Usually everybody knew that day was a coming.
Wasn't a mystery.
And now it's just kind of a non-incidental thing. The mere inconvenience of changing out sanitary products is really the big issue. But what you get from it is just, some women are like, oh, I'll die with my estrogen in my hand. And I'm one of them. Anybody
Get your life back.
Well, yeah, because I have my brain, who I am, and I can cope with anything that comes my way. I'm not like that when I don't have estrogen. I'm useless, hopeless, useless, undependable, moody, hard to be around, can't sleep, don't want to be touched, don't talk to me, don't want to go out anywhere. And like I said, I've been off of estrogen a couple times. I was advised by doctors, and I listened to them, that I'll never do again. So I've been in and out of menopause. And I am reminded every time I'm back into menopause going, oh,
It's miserable.
Like, I'm not, if I have a choice in my life, I feel like I am dying and want to take everybody with me when I'm in menopause. When I'm like, I'm not doing that anymore, because I'm either going to go back on half a dozen to a dozen psychotropic drugs when I'm off of estrogen, or I can get back on estrogen and be on nothing. And so
Marie, what is the one thing that you want to leave the audience with today?
Well, the one thing that I want to leave the audience with today is, if you have labs and you think your hormones aren't balanced, I'm happy to review those labs with you. I do have if you go to the website freelabreview.com, you can set up your listeners can set up a consultation, and I'll go over the labs. It's just a quick consultation, and I'll review labs and answer any hormone questions just free of charge. And I don't sell anything. You know, what I do is not for everybody. But I do want to get the message out, to use the term awareness, that women do have a choice. And I'm here to spread the word that women now have more control over how their brains and bodies age, or whether they experience going into that menopausal nightmare than they ever knew. So freelabreview.com, set up a consultation. That's what I'd like to leave your listeners with, that there is hope. You can actually control how your brain and body function.
Thank you so much for sharing this information with us today. I had no idea. It has really been eye-opening for me. Thank you.
You bet, Jill. It's really nice being with you. Thank you, and your listeners.
Thank you so much for tuning in to another empowering episode of the You World Order Showcase podcast. We hope you've enjoyed hearing from our incredible life, health, and transformational coaches who are making a profound impact on the world. Remember, change begins with you, and you have the power to transform your life and the lives of others. If you want to take that next step and unlock your true potential, visit thecoachesalchemist.com, where you can find the 3 ways we can help you for free to spin your talent into gold with clarity, a system, and a plan. Don't forget to hit the subscribe button so you never miss an inspiring episode. And if you enjoyed today's show, we'd greatly appreciate it if you could leave us a review on your favorite podcast platform. Your feedback means the world to us and helps us reach more people with our positive message. Stay connected with us on social media for updates, behind-the-scenes content, and upcoming guest announcements. You can find us on Facebook at the You World Order, or simply visit thecoachesalchemist.com.